Radioactive iodine has been used in nuclear medicine imaging for almost 90 years, and it was developed by a man named Carl Compton. The point of developing this new isotope was to possibly treat and diagnose pathology in the thyroid because iodine is taken up by the thyroid in large amounts. The first radioactive iodine that was produced was iodine-128, but its downside was the half-life was only 25 minutes, and it was not reasonable for long-term imaging. The team that included Carl Compton soon realized another group located in Berkeley, California, was developing a longer-lived isotope, that being iodine-130, with a half-life of 12.5 hours, and iodine-131 with a half-life of 8 days. This was just the beginning for radioactive iodine in the imaging world, because now there are multiple iodine isotopes being utilized, including iodine-123, iodine-130, iodine-131, iodine-126, iodine-125, and the newest being iodine-124. This topic is ideal for everyone in the imaging field because not many in the field know very much about I-124 yet. Students are starting to be asked questions about it on their board exams. The knowledge of this topic is becoming more widespread, but the intent of the review and the poster is to keep closing the gap of knowledge about I-124. This poster is discussing how I-124 is being used in today's molecular imaging and how it got to be there, but will not discuss other isotopes in much detail, and all the studies available on I-124 cannot be covered in one review. Positron emission tomography, or PET, is what happens when positrons are detected and then turned into signals, which is then turned into an image and data that can be read. PET imaging has been around since about the 1950s, and PET-CT combines physiology and anatomy, making it the best of both worlds for molecular imaging. Iodine-124 is a cyclotron-produced isotope with a half-life of 4.2 days, and around 23% of its disintegrations are at a high enough energy level to be properly imaged by the PET scanner. I-124 has great potential in PET because of its longer half-life and high energy capabilities. I-123, 125, and 131 have their uses in SPECT imaging, which is single photon emission computed tomography, and are effective in diagnosing and treating pathology, but they do have their downsides. Iodine-123 is great for imaging and for the quantifying uptake in the thyroid, but it does have a short half-life of 13 hours and is hard to scan for multiple days. I-125 is effective for certain therapies, but has too long of a half-life, being around 59 days, and it has its energy too low to produce images that give any qualitative or quantitative data. Lastly, iodine-131 is the most used of the three, and yet it still has issues with having too high of an energy to properly image, therefore it is used commonly in therapies for the thyroid. Iodine-124 is still considered a newer isotope and is being tested all the time in ways to make it better for clinical use. Even though it looks promising in the PET industry, it has downsides like other isotopes, has higher than normal impurity rate, which means only the highest radioiodine purity should be used diagnostically, while the lower levels of purity could be used for therapeutic procedures. Kohler et al. Noted in their findings that iodine-124 has a more complex decay scheme, which means around 65% of the time iodine decays into tellurium-124, which is still in an excited state. This causes problems when the PET scanner cannot distinguish between the high-energy photons coming off the tellurium-124 and the annihilation photons coming off the I-124, therefore causing false positive line of response. To help correct this, scan time has increased when using iodine-124 because the dose must be less than other PET isotopes. Most isotopes are labeled compounds, and iodine-124 is no different. Some examples of this are I-124-MIBG, I-124-IAZA, and iodine-124 labeled heparicin, but this will be discussed later. Before iodine-124 was being used in different positron emission tomography studies, different isotopes of it were being used to diagnose and treat thyroid cancer. Different uptakes and scans using SPECT have been used in the field of nuclear medicine for years now, involving the thyroid. For example, I-131 has been used in capsule form to help ablate the thyroid to help treat hyperthyroidism as well as certain thyroid cancers. It can also be used in small doses to do a whole body scan, looking for thyroid cancer metastases. Seifert et al. Wrote about the comparison between I-124 PET imaging in combination with ultrasound and technetium-99m pertechnetate scintigraphy in combination with ultrasound to see which one was the more accurate in assessing thyroid nodules. They first started out by noting that the current standard is for assessing the metabolic function of the patient's thyroid nodules, which is done by a physician reading a technetium-99m pertechnetate scan and multiple images from ultrasound at one time. One of the downfalls of this method is the poor spatial resolution both modalities have compared to SPECT or PET imaging. Therefore, the use of PET imaging and ultrasound side by side has started to take off, but there only have been a few case reports on the topic. The results of these studies were well regarded because the ambiguous findings through conventional diagnostics including labs, thyroid ultrasound, and Tech-99m pertechnetate scintigraphy were found unambiguous about 96% of the time when PET and ultrasound were used together. Another study that evaluated the use of I-124 and PET-CT was conducted by Jensen et al. Using 2-dimensional and 3-dimensional modes on the PET scanner for patients with differentiated thyroid cancer. Findings include those of differences in spatial resolution, problems with the cascade photons, which is discussed in an earlier paragraph, and differences in recovery coefficients. In one of their noted findings, it was stated that since I-124 emits these photons that cascade, it was creating more inaccuracy in 3D mode than in 2D mode. If a correction method was applied, then the inaccuracy would go down and they would be more comparable, but they still concluded that recovery coefficients were better in 2D mode than in 3D mode. Santhanam et al. Performed a systemic review of multiple studies using I-124 in detecting lesions of differentiated thyroid cancer. They came to a similar conclusion that other studies have had, which is that I-124 used in PET-CT is better than I-123 when using SPECT-CT because of higher contrast and spatial resolution abilities. It was also mentioned that I-131 is inferior to I-124 in finding smaller lesions in patients with thyroid cancer, which can cause problems for patients planning on having surgery to their thyroid. Studies being done with I-124 have been going on since the early 2000s, and yet they are still relevant today, including one done in 2002, testing to see if I-124 was able to evaluate the dosimetry of radioiodine therapy in benign and malignant thyroid disease. The information gathered in this study was taken 1 to 13 days after patients have been given an iodine-131 therapeutic dose and an I-124 diagnostic dose. Phantom studies were also conducted with I-124 to see inaccuracy measurements to make sure it was up to the standard for quantification. From the quantifiable data they gathered, it was concluded that dosimetry being done with I-124 is possible with PET because the calculations are in the limits of accuracy that is acceptable for clinical use. Ashman et al. Also noted that if a patient has smaller lesions, it will cause issues because of the lack of spatial resolution in PET, which was also noticed in the Santhanam et al. Systemic review that was mentioned before. There was a case study done in 2003 using I-124 for diagnosing metastatic lesions from a thyroid carcinoma in a patient who was 75 years old. 100 megabecquerels of I-124 were given orally to this patient, and 24 hours later he was scanned by a PET-CT scanner, and lesions were found in multiple locations all over his body. It was decided that further imaging was needed with fluoride 18-FDG, which is fluorodeoxyglucose, because an iodine-negative tumor was suspected. Freudenberg et al. Concluded that iodine-124 is beneficial to use in diagnosing thyroid disease, but without the combination of PET and CT for the metabolic and anatomical processing being visualized, it is hard to be accurate in diagnosing the staging. I-124 is an effective way to diagnose different thyroid pathology and is being used more often as the years go by. Iodine-124 is known for its use in diagnosing and treating many thyroid pathologies as well as its other isotopes in nuclear medicine, but it can be used for more than that. There was a recent study done in 2020 that used iodine-124 labeling of adeno-associated virus and positron emission tomography to see whole body and organ-specific absorption in African green monkeys. Adeno-associated viral vectors are used in gene therapy, and there are the most frequently used type of vector for gene therapy. I-124 was given to the primates through intracisternal and intravenous injections to see how it was distributed through their bodies. This type of monkey was chosen because of how similar their physiology was to humans and how this study would be scalable enough to go to humans in the future. When it was time for images to be acquired, a Siemens Biograph MCT PET-CT scanner was used with 4 detector heads. The uptake that was detected was primarily located in the thyroid, submandibular glands, and parotid glands, which is to be expected when using iodine-labeled isotopes. Fallon et al. Believe that iodine-124 will be used in the future for more studies on this nature to develop the capsid technology used in the study. This method allows the distribution fraction and total vector dose to organs be measured in an accurate way that can be used with humans one day. Ways to diagnose and image Parkinson's disease have been around for a while now, and with the help of I-124 BCIT, beta-carbomethoxy-3-beta, for idophenyltropane, it can be scanned in a new way. 30 megabecquerels were given to a 31-year-old man with suspected early onset Parkinson's disease. His images showed that uptake was normal and symmetrical in the striatum, but a hot spot was discovered by coincidence in the left parietal lobe of the brain. An MRI was ordered as well as other tests, and it turned out to be a MET from a cutaneous malignant melanoma found on the patient's finger. This is an impressive accidental discovery for I-124 because usually F18 FDG incidentally discovers metastatic lesions, but there are a few research studies on other radioactive tracers discovering them. More research should be put into I-124 and the possibility of detecting other types of tumors throughout the body that are not just from the thyroid. Another way I-124 is being used in PET is imaging neuroblastoma. Meta-iodobenziguanidine has been a staple in the modality of nuclear medicine for years because of its ability to detect neuroblastomas. It has commonly been paired with I-123 for whole body planar imaging or SPECT-CT imaging. I-124 MIBG has been gaining popularity because of its use in PET imaging. As discussed previously, positron emission tomography can produce higher quality image resolution and spatial resolution. In a recent study published by Aboyan et al., they have shown that I-124 MIBG can get even more useful than I-123 MIBG for obtaining tumor dosimetry for children with neuroblastoma before receiving an I-131 MIBG therapy. In this study, the subjects had to have been older than 3 years old, and their guardians needed to fill out a written consent form for the I-131 treatment. Images were taken with the first 4 hours, and then after the 24, 48 hours, and 120 hours later. The significant findings of the study were that only 1 lesion went undetected from I-124 MIBG, while 63 went undetected from the I-123 MIBG planar imaging, and 55 went undetected on the I-123 MIBG SPECT-CT scan. This is quantifiable data in favor of using I-124 for further scanning of neuroblastoma in children, which can lead to more discoveries down the line of diagnostic capabilities of iodine-124. Different studies and research about I-124 are becoming more available as years pass on because it's promising new isotope. Even though some of the studies mentioned in the Lit Review are from the early 2000s, they were easily compared on the studies happening closer to 2021. Positron emission tomography combined with computed tomography is said to be the future of nuclear medicine because of its enhanced imaging resolution and its ability to view physiological function and anatomical regions of the body. Most literature revolving around I-124 describes it as a better alternative to I-131 or I-123, but both isotopes still have their own advantage. The consensus of the articles reviewed agreed with the fact that I-124 needs further testing in areas where incidental findings occurred. Research about I-124 detecting brain mets should be considered because it can lead to other ways of detecting mets from various other cancers in the body. There was not enough research found about the use of I-124 in children with thyroid cancers and if it is a possible option for them to be imaged with. It is specifically stated in a research study that further dosimetry studies should be conducted to fully understand the role of I-124 in the future of PET imaging. I-124 could be the new and better isotope for assessing and diagnosing thyroid pathology, detecting multiple cancer metastases, and delivering effective gene therapy to humans in the future, all because of its use with positron emission tomography.